Hello everyone, welcome back to another engaging tutorial in our critical appraisal series. Today's session is about taking critical appraisal out of the classroom and into the real world. Because let's be honest, critical appraisal is not just about evaluating studies for the sake of it. It's about transforming that evaluation into actionable insights that drive decisions, whether in patient care, research, or healthcare policy. So, what are we going to cover today? First, we'll explore how to apply critical appraisal skills in real-world settings. You'll learn how to bridge the gap between evidence and practice, turning data into meaningful, real-world solutions. Next, we'll discuss how to communicate the results of critical appraisal effectively. After all, having evidence-based insights is great, but if you can't communicate them clearly to stakeholders, whether it's your team, leadership, or even patients, those insights lose impact. By the end of this tutorial, you'll have a practical roadmap to use critical appraisal as a tool for driving meaningful change and ensure your message lands with clarity and confidence. So, whether you're a clinician, medical affairs professional, or researcher, this session will help you apply critical appraisal where it truly matters, out there, in the real world. Now let's get started. In this part, we're going to focus on what I like to call the real test of critical appraisal, using it in real-world settings. You see, it's one thing to evaluate evidence in a structured classroom environment, but it's another to apply those same skills in a dynamic clinical or professional setting, where you're often faced with conflicting evidence, time constraints, or limited resources. But this is where critical appraisal really shows its value. When used effectively, it enables us to make informed, evidence-based decisions that lead to better patient outcomes, improved resource allocation, and stronger team collaborations. So here's the game plan. We'll start by bridging the gap between theory and practice. Then, we'll explore real-world case studies that show critical appraisal in action. Finally, we'll discuss how critical appraisal drives collaborative decision-making in multidisciplinary teams. Let's start with an important point. Why does applying critical appraisal matter in real-world clinical settings? Imagine this. You're faced with two studies offering conflicting evidence about a treatment. How do you decide what's best for your patient? That's where critical appraisal comes in. It helps you assess the validity, relevance, and applicability of the evidence to ensure you're making the best possible decisions. Now, applying these skills outside the classroom isn't without challenges. Conflicting evidence. Sometimes two high-quality studies will present different conclusions. For example, one trial might favor a new treatment, while another shows minimal benefit. Time constraints. In a fast-paced clinical environment, you might not have hours to review every study. Resource limitations. Access to full texts or advanced tools can sometimes be limited, especially in resource-restricted settings. So how do you overcome these barriers? Here are a few strategies. Prioritize evidence. Focus on high-quality studies that address the clinical question directly. Use systematic reviews or guidelines when possible. They save time and offer synthesized evidence. Develop a decision framework. Establish a structured approach to evaluating evidence. For example, always check the study design, population, and outcome measures first. Embrace uncertainty. Sometimes, evidence will be incomplete. In those moments, rely on clinical judgment, patient preferences, and expert consensus. In the real world, balancing evidence with real-life constraints is the key. Now let's move to some practical case studies to see these strategies in action. Case study 1. Evaluating a new drug for chronic disease management. Let's say a new drug is introduced to manage a chronic disease like diabetes. As a clinician or decision maker, your task is to critically appraise the evidence. What do you look at? Clinical trials. Are the randomized controlled trials, RCTs, well designed? Are the endpoints clear and clinically relevant? Balancing benefits and risks. Does the new drug improve glycemic control? What about its safety profile? Any adverse effects? Treatment decisions. How does this drug compare to current therapies? Can patients adhere to it? Is it cost-effective? By critically appraising this evidence, you ensure that the decisions you make are based on facts, not assumptions. Case Study 2. Treatment decisions in rare diseases. Here's another scenario. You're dealing with a rare disease where robust evidence is lacking. What do? Appraise limited evidence. Use what's available. Case reports, small cohort studies, or early phase trials. Incorporate expert opinion. Consult specialists or rely on clinical experience when evidence is thin. Address ethical dilemmas. For example, offering experimental treatments requires clear communication and informed consent. In rare diseases, your critical appraisal skills allow you to weigh limited evidence carefully while keeping patient needs at the forefront. Case Study 3. Emerging public health data. Think back to the early days of a pandemic. New data emerged every day, but much of it wasn't peer-reviewed. How do you critically appraise this? Rapid evidence synthesis. Use tools to quickly evaluate preprints, government reports, and observational data. Public health recommendations. Balance evolving guidelines with individual patient care. These examples show how critical appraisal is applied in real-world, high-pressure situations. Now let's explore its role in collaborative decision-making. Critical appraisal doesn't happen in isolation. It thrives in multidisciplinary teams. In these settings, professionals from different specialties come together, each bringing unique expertise to the table. But here's where things get tricky. What happens when team members disagree? Critical appraisal helps in 3 ways. Integrating diverse expertise. By focusing discussions on the evidence, critical appraisal ensures decisions are grounded in facts, not opinions. Facilitating structured decision-making. For example, creating a framework where everyone discusses the evidence, patient preferences, and potential risks can help resolve conflicts. Building consensus. Techniques like the Delphi method or nominal group technique can guide the team toward agreement in complex cases. Imagine a patient with cancer being treated by oncologists, radiologists, and pharmacists. Differences in opinion are bound to happen. Critical appraisal ensures the team uses evidence to find common ground and deliver the best outcome for the patient. So, in order to move to the next part of this tutorial, let's see what have we learned here. Critical appraisal isn't just about evaluating studies in theory. It's about applying those skills to real-life situations. Whether it's evaluating new treatments, handling limited evidence, or driving decisions in multidisciplinary teams, critical appraisal empowers you to make evidence-based decisions that improve patient outcomes. And remember, when evidence is incomplete or conflicting, don't panic. Use a systematic approach, rely on expert collaboration, and focus on what matters most: patient care. Now that we've covered the importance of applying critical appraisal in real-world scenarios, let's move to the next vital aspect: communicating critical appraisal findings effectively. After all, even the most robust analysis will lose its value if it isn't communicated clearly and persuasively. In this session, we'll explore why communication matters in evidence-based practice, tailoring communication to different audiences, best practices for writing reports and delivering presentations, leveraging digital tools for communication, building consensus in teams. So, let's get started with the first key point. Why does communication matter? Critical appraisal findings must reach those who need them, clinicians, policymakers, or patients, because these insights drive evidence-based decisions. Think of it this way. A critical appraisal of a study may uncover better treatment options, but if that evidence isn't shared effectively, it won't improve patient care. Multidisciplinary teams rely on communication to align their understanding of the evidence and collaborate on solutions. Poor communication can lead to missed opportunities, misunderstandings, or worse, poor outcomes. For example, imagine a critical appraisal identifies new evidence supporting a novel therapy. If this isn't communicated clearly to the treatment team, they may continue relying on outdated practices. One size does not fit all. How you communicate depends on who you're speaking to. Let's break this down. Healthcare professionals focus on clinical relevance, the quality of the evidence, and the practical impact on patient care. Example: when presenting to a cardiology team, emphasize how the findings affect treatment guidelines or patient outcomes. Patients: simplify technical data into understandable language. Focus on how the findings benefit their care. Example: this study shows that using this treatment reduces heart attack risks by 30%. Policymakers: highlight the broader implications, public health impact, cost effectiveness, and potential policy changes. Example: implementing this screening program could reduce hospital admissions by 20% over 5 years. Now, let's see how to write a clear and persuasive critical appraisal report. Writing is one of the most common ways to communicate findings, so let's talk about how to do it effectively. Structure: every report should include introduction. What's the purpose? What question is being addressed? Methods: how was the appraisal done? What criteria were used? Results: what are the findings? Highlight both strengths and limitations. Discussion: what do the findings mean for clinical practice or policy? Conclusion: summarize the key takeaways and recommendations. Best practices: use active voice for clarity, be concise, focus on essential data, and avoid unnecessary jargon. Ensure precision, back up findings with specific terms, numbers, or visuals. Example: instead of saying, "It was found that patients benefited from treatment," write, "The treatment reduced patient mortality by 20%. What about when you have to present the results of your critical appraisal work? And by the way, you can extend this to any type of scientific medical presentation of any research. Presentations are powerful. Whether in a meeting or a webinar, here's how to make your message resonate. Organize your content. Focus on 3 to 5 key points and structure your talk clearly. Introduction, main findings, and conclusion. Use visual aids. Graphs, tables, and infographics simplify complex data. Make sure they're clean and easy to understand. Engage your audience. Encourage interaction with polls, questions, or discussions. For example, if presenting findings on the benefits of a screening program, use a graph to show how screening improves early detection rates and reduces costs over time. In the digital age, we have more platforms than ever to share findings. Let's look at a few examples. Blogs. Simplify findings for a broader audience. For instance, summarize a study on patient outcomes for non-specialist readers. Webinars. Engage audiences with live presentations and Q&A sessions. Social media. Platforms like LinkedIn or Twitter allow quick sharing of insights to spark professional discussions. Tools to create visual content. PowerPoint for slides, Canva for infographics, Prezi for dynamic presentations, and Tableau for advanced data visualizations. These tools can make even dense critical appraisals visually appealing and accessible. Ladies and gentlemen, effective communication isn't just about sharing information. It's about building consensus, especially within multidisciplinary teams. Key strategies include active listening, understand and address the concerns of team members, focusing on common goals, align discussions around shared priorities, like improving patient outcomes. Summarizing discussions. Regularly recap key points to ensure everyone is on the same page. Example: in a team debating two treatment options, summarize the appraisal findings, clarify areas of agreement, and highlight shared goals, like delivering the best possible patient care. In summary, effective communication is the bridge between critical appraisal and real-world impact. Whether you're writing reports, presenting to stakeholders, or leveraging digital tools, mastering these skills ensures your findings drive meaningful change in evidence-based practice. Thank you for joining this tutorial. Keep practicing these techniques, and don't forget, your ability to communicate critical appraisal findings is what turns evidence into action.